We've talked a lot about the fact that we can get injured in dance. And I talk about this because it can come as a surprise. We have those who think that dance is just easy peasy, no work, and we forget that we're using our physical selves to create this art form. We are athletes, and we're using our muscles and our entire bodies to create this stuff. And with that, unfortunately, comes injury. Now, we've talked before about little things in those regards, but now I'm talking about returning post-injury for those who are doing point and toe stands. This brings about a different dynamic. I see dancers try to jump back into things thinking that it's gonna be easy peasy right away. Now, if we're talking about a foot injury specifically, there are certain cases where you may have to revisit doing demi-pointe again. This goes back to working with your doctor and understanding what your body is permitted to do. Others are able to get back into point fairly fast. Again, it takes time after any injury. But when you come back in, you need to retrain your body for what is okay. It may be different than whatever physical therapy may be requiring of your body, because again, we're pushing your body a little bit further past normal limits here. And so you have to take that in consideration, especially, like I said, if you've had a foot injury or anything in the leg vicinity that can be impacting your point abilities or your toe stands. I don't want to see dancers rush. It can actually backfire and cause you to take longer to heal if, in fact, you try to rock out some fletes like 2 weeks back in after returning from a massive break in your leg. Even tears, you may have the okay to resume dance classes, but that does not mean your body is physically conditioned again to withstand the moves you were doing previously. I've said before that on average, for each week that you are out, it takes a good 2 weeks for you to get back to normal. That's a rough guideline. That is not always a promise. So kind of take that in consideration. Be kind to yourself. That doesn't mean you have to be afraid of doing the moves again. That just means that you should be taking care of your body and staying focused and working with whomever is your specialist, for your doctor or whomever, and making sure that you are training appropriately. Sometimes when this happens, it is also even encouraged that maybe you take a lower leveled class and revert back to some of the basics, so that way you can retrain your body again in that safe fashion. I will see you tomorrow as we talk about demi-pointe.